Did he get knocked out of the Zoom? I don't see him anymore. We can't hear you.
All right, I fell off, I believe, so we're ready to begin. We can,
Okay.
yeah. So we can start letting people in. Dr. Kimberly, as soon as you start, you can start to greet, and then Jasmine, you just push record.
All right. Ooh, oh, shoot.
Yeah, that's good. That's good.
I didn't mean to do that. I'm sorry.
Good morning, everyone. Good morning. Good morning and welcome. Welcome. It's so nice to see everyone joining. Thank you for joining me today.
Peace and blessings, Dr. Kimberly. How are you doing this morning?
I'm doing good. Thank you so much for asking, Adam.
Good.
How are you?
Every day is a good day. Every day that I wake up with a full family.
That's good. I like to hear that.
Yeah.
Peace and blessings, Dr. Kimberly and Woo Nation. Love y'all.
Thank you. Blessings. Very good. Welcome, welcome. Good morning, everyone. Just allowing a few more moments for more people to join us. Very good. Again, my name is Dr. Kimberly Navarro. I am a certified nurse midwife, a women's health nurse practitioner, a social scientist, an author, poet, teacher, and founder. And today I'm going to be speaking on the Black maternal health crisis and the history of Black midwives and how those two topics connect and intertwine. Hey, thank you, Miss iPhone Sweetness. Good morning. All right. So I'm excited. I'm very happy to be here with you this morning and sharing my research on this topic. I just published my dissertation called Black Midwives for Black Mothers and How to Ameliorate Disparities in the Quality of Maternal Health Care. So that is where I'm speaking from. And I hope to make it an open discussion with you all. I have questions that I want to ask you throughout this meeting, and I hope to hear from you. I hope that we can share and connect together.
Wake up, everybody. It's time to get up. Wake up, everybody. It's time to get up. Stay woke. Stay woke. Stay woke. It's time to get up. Stay woke. Stay woke. Stay woke. It's time to get up. We're healing, we're dealing, we're growing. Together, releasing. We're teaching, we're moving. Together, together, we're learning, discerning, we're striving. Together, together, we're leading, connecting, transforming. Together, together.
All right, everyone, good morning and welcome. Thank you for joining me this morning as I present on the topic of the Black maternal health crisis and the history of Black midwives. Again, my name is Dr. Kimberly Navarro. I'm a certified nurse midwife, women's health nurse practitioner, social scientist, author, poet, and founder. And I would like to begin my presentation just speaking on the importance of the maternal health crisis and what that's about. So first, I would like to share that, childbirth is a female biological phenomenon that frames the dichotomy of harvesting new life and the risk of fatal health implications. And worldwide, an unprecedented number of women die daily as a result of pregnancy and childbirth. And the number is about 800 women die around the world daily as a result of pregnancy. That is called the maternal mortality rate. Now, in the United States, maternal mortality represents a dire health crisis with a stark racial imbalance. Women in the US are dying before, during, after pregnancy at the highest rate compared to any other developed country in the world. And Black and brown women carry the heaviest burden of that maternal mortality rate. Black women are dying 3 to 4 times the rate of their white counterparts. So the maternal mortality disproportionately affects Black women. And the question is why? And when we look at it, education and socioeconomic status do not serve to protect Black women from these poor maternal health outcomes. As a matter of fact, a study that studied 2 million births in California found that the wealthiest Black mothers were twice as likely to die as a result of pregnancy and birth as the wealthiest white mothers. And 5 times more Black mothers with a college education die from pregnancy and birth complications as compared to their white counterparts with college education. And since the COVID-19 pandemic, these rates have just exacerbated. According to the Wall Street Journal, the US maternal mortality rate has just catapulted in 2021 to the highest level it's ever been since 1965. And it is because some of the issues have been exacerbated, like access to healthcare since the COVID-19 pandemic. And the worst part about it is that most of these deaths are preventable. The rate of preventable death is a problem that is actually worsening here in the United States. Globally, the maternal mortality rate is improving, but in the US, it's a worsening issue. And then we have the example of California, the state of California. As a state in whole, the maternal mortality rate has improved, but for Black women in California, the maternal mortality rate has remained the same. Black women in California are dying 4 times the rate as their white counterparts. And this is a very serious, very important, very urgent issue going on in the United States. And for that reason, in 2021, Vice President Kamala Harris hosted the nation's very first White House Day of Action on maternal health to bring attention to this issue and to address the intricate national problem of maternal mortality in order to find a solution. And also, it's important to note that Time Magazine recognized a Black midwife here in the state of Florida, where I'm currently at. Her name is Jenny Joseph, and they recognized her as Woman of the Year for her contributions to ameliorating Black maternal mortality. So when we think about this issue of this Black maternal health crisis, and we look at the history of obstetrics, we realize that this hasn't always been an issue. And so the question is why? What has transpired? What about obstetrics is leading to Black women dying at a disproportionate rate? And all the research now coming out is showing something that probably most of us already knew. And it's about racism. Systemic racism has a lot to do with this disparity in maternal health outcomes and the quality of maternal health care. Poor maternal health outcomes for Black women cannot solely be attributed to poverty, education level, and access to healthcare, as we once assumed. Because regardless of income level and education level, Black women are more likely to die of pregnancy and childbirth, which is a healthcare disparity primarily related to systemic inequalities. So I would just like to kind of pause right here, speaking of this systemic inequality, systemic racism in the healthcare system, and kind of open up a question to the group and kind of hear from you guys. How real is this topic for you? Have any of you in the group ever experienced discrimination, hostility, unfair treatment while in the hands of a professional that's supposed to be taking care of you? I'm curious to know how relevant this topic is and if it resonates with anyone. Feel free to share in the comments.
Yeah, I see Teresa's hand is up. Grand Rising, Teresa. You can unmute.
Peace and blessing. It's very important to me. I'm part of the Speak, Move, and Change on the Porte that we talk about Black maternal health, and we're working on creating an event in the next couple of months. It's 2 events. The Speak, Move, Event Change. I don't have the exact dates, but I know it's coming up. Well, I don't know. Maybe Jazz can help me remember the dates, but we have a big event, and it's something dear to my heart because I just feel like the Black woman has not been respected and honored. The body has not been respected in so many areas, but especially in that area. And, we're just trying to create a system where people can be aware of what's going on and how to get help if you're experiencing that. And I'm complete.
Thank you for sharing, Ms. Teresa. And you're absolutely right. There is a long history. Black women have a long history of receiving poor maternal health care and having poor maternal health outcomes. But the problem is that there is a gap in the literature, in the research that's understand why this issue is going on. And this maternal health crisis cannot be properly addressed or understood without understanding racism in the healthcare system. It's racism, not race itself, that is a driving force behind the high rates of maternal death among Black women. And understanding, the relationship between the healthcare provider and the patient, the race, the lived experience of Black women during pregnancy and childbirth is fundamental to understanding the racial and maternal health and its and how it relates to these disparities. And like I said, unfortunately, when you look at the research, when you look at the literature, the voices of Black women, their experiences with maternal health care is largely lacking as a patient and also as researchers. So this is another reason why it's a personal mission of mine to help continue to amplify the voices of Black and brown women in the literature as researchers, and also as as participants, as patients, and their perception of the quality of care. And that's exactly why I did my research. I was directly interviewing Black women about their experiences with pregnancy and childbirth. So I just want to quickly make sure there's not anyone else that wanted to share their experiences. I see one hand up.
Witness's hand is up. And I would also like to share too.
Go ahead.
I'm gonna go, Jazz.
Yes.
Okay. Peace and blessings, grace and love extended to the Wu family this morning. So, what I was thinking about when you were sharing, well, first, kudos to all your hats that you wear, letters in front and behind your name, facilitator. So glad to see your beautiful face and all the education you have inside of you. So, thank you for showing up. I was thinking about just being conditioned from the things that I've seen on television concerning giving birth, right? I'm 62 now. However, when I was younger, the TV was a big thing. So, say for an example, if I'm watching a show that they're trying to tell me what was going on in the days of slavery, right? So, in my mind, it was not a lot of importance put around giving birth, right? You give birth because you property, right? So like the cows and the horses, you give birth, you snap out of it and you keep it moving. So when I think I'm sharing my thoughts, right? So when that happens in my mind, then where do I get the importance of my body, of the function of my body? Where does that come from? I don't remember my mother sitting me down or standing me up and teaching me and talking to me about how relevant I am as a being because I have a womb. So I'm thinking about when you say racism is the core, because if it's systemic, then it's the core. How far do we go back? Where is it? Not to place any blame anywhere, however, just to understand, why do I have a view of my body that I do? And so how do I share? I gave birth to 2 sons. So how do I share with them to reverence that in a woman if I don't even know, right? So I can't say that I've been directly impacted by this, but if I am woman and African American, then it is directly impacting me because of those things that I've said. So that's what I wanted to throw out there, is that me understanding me as a we collective, understanding my importance, my relevance to the fact that it's my womb that allows the earth to replenish, right? So if they were using us, when I say they, the oppressor, if the oppressor was using us for free labor, and free labor basically is no more unless you go to prison, and prison is free labor. So, but if you don't go to prison, then free labor is no more. So then what use does the oppressor have for me? So I'm not surprised at the lengths that things are happening. So yeah, this is woo. It's wake up time. So thank you for showing up again, and thank you for allowing me to share. With that, I'm complete.
Yes, that's an amazing question. And I'm so glad you brought that up. You brought up those feelings, those questions, those thoughts. It's so important. They're thoughts and feelings that I myself can relate to about where did the value of our body as women go, and who framed the notion of the value of our womb, of our reproductive system. And I had those same questions until I did my research, until I dig deep into the books, into the history of talking to people. And I would like to kind of bridge into the information, answer those questions, hopefully answer those questions, provide some information about what I learned. So I want to start my response to that by sharing a little bit of history. So back when this country first started, right? Childbirth historically had been a job of women, all women in the community, midwives, mothers. They were the gatekeepers of the knowledge and the practice and the art of childbirth. And it used to be that women delivered their babies at home. They gave birth at home with the assistance of midwives and their family members and other women in the community who would come to support the mama, to learn. They would come to learn, to, just to embolden each other with information and light and support. And so in the 17th century, then came the rise of the profession of obstetrician. And it was kind of a competition for them because midwives and women held all the knowledge and all the practice, and women only, delivered at home. And so what happened was that the obstetrician, which were largely white men, they started to kind of slip into and start to frame this discourse of fear into birth, and started to kind of create this conception that, birth was dangerous and birth was life-threatening, and it needed the intervention of a doctor and surgery in order to, to have a safe birth. And so that idea kind of creeped into the minds of women. And so it is kind of an irony that women at that time wanted more control of their body with like medicine to relieve pain and stuff like that. So at the same time that they wanted more control, they gave up their control. They surrendered the control of their body to the hands of these largely white male physicians to deliver their babies. And if you look in the history books, if you Google the pictures of how, birth in the hospital used to be in the beginning, women were literally drugged up completely, tied down completely, and it was a complete surrender of their bodies to the doctors, who would deliver the baby, and the mom would have no idea of what was going on. I'm talking about no bonding, nothing, no knowledge of what was going on. So in the beginning, this was a privilege that only middle-class upper white women could have, to deliver a baby in the hospital, that, a painless birth and supposedly a safe birth. And I say supposedly because at that time, there were no statistics of what the birth outcomes were looking like. There was no statistics proving that it was safer. But so I say that little piece to show how slowly the power, the knowledge around childbirth was taken from midwives and women and given to men, white men, physicians in the hospital. And so from there, then I want to kind of add in the history of Black midwives. So again, remember, only upper middle class white women were actually able to afford these painless surgical deliveries in the hospital. For the rest of the population, midwives were still it. Midwives were still delivering babies. So in the early 1900s, midwives attended to 50% of all births in the United States. And in the Black, indigenous, immigrant, poor communities, still 90% of births were happening with, under the care of midwives. And at that time, some midwives were white, but before the 20th century, most women in the Northeast were immigrant women, and most women in the South, most midwives in the South were Black. The Deep South harbored a legacy of midwives deeply ingrained in the Black culture. The root of Black American midwifery transcends from the arrival of slave ships in the 17th century to the Black, all the way through to the Black women who were delivering babies still in the 1950s. African remedies, birthing traditions were secretly passed down through generations, circulating through the Black midwives. And I want to share this last little piece of history before I go back and open it up to questions. But I just want you to know that in the early 17th century, the slave trade brought many enslaved Africans to the US. And among them were women with generations of knowledge, tradition, folklore, art related to the midwifery practice that came from the motherland. And certain women from African villages were actually strategically captured for their knowledge and skill in the birthing practice that were used by the American plantation slave owners to deliver the babies of these enslaved Black women. And so, obviously there was a booming cotton industry that was largely, dependent on the enslaved population. So it was important for slave owners' revenue and money to have enslaved Black women continue to, deliver healthy babies. So at that time, during the slave time, it was in the interest of these white slave owners for Black women to have healthy babies, for Black women to continue to reproduce, because it was making them millions, billions of dollars. Now, in 1807, when the international slave trade was abolished, that notion just catapulted even more, because now the growth of population of enslaved people were dependent on midwives. They could no longer bring the midwives from the motherland. So the American midwives were solely, had the task of continuing this process. And so a little bit more history about that. At that time, also the profession of obstetricians were also growing. So then the slave owners would pay these white obstetricians. And there's one, I'm sure you guys know the history of J. Marion Sims, which he was given the name of the father of gynecology, but he did all of his practice on his plantation on enslaved women. And there's one important story, I'm sure you guys know about the story of Anarcha, who was an enslaved woman. And J. Marion Sims performed 13 unanesthetized surgeries on this woman until he was finally able to master the repair of a fistula. And it was And it was because of this woman, Anarcha and Betsy and Lucy, who were enslaved women who contributed to his practice and his knowledge of him, being able to master this repair of the fistula so that women can continue to, to give birth and deliver their babies. So I wanted to paint this picture of how horrendous, these white obstetricians were practicing medicine at that time. And it wasn't, and the whole reason behind them wanting Black women to deliver healthy babies was greedy, was selfish, was inhumane. On the other hand, midwives, the Black midwives who were practicing for free, on the contrary, were doing it, just based out of love. And so many times when people in the enslaved community became sick, women, men, children, anybody in the family, whether it be pregnancy or not, an illness or any type of infirmities, they were required to report it to the overseers, and the overseers would then bring them to the physicians, who would treat them poorly. And so that was avoided. And so people in the Black community, in the slave community, preferred to go to a midwife and get all their health care and healing from midwives. So I want to stop right there. And after painting this picture of, maybe perhaps why the distrust in the healthcare system, and in the hands of these physicians, and why the respect and the trust in the Black community for Black midwives, because of this historical difference in treatment and care that was going on. I want to pause right there and perhaps touch base back with you guys and see, did that answer any questions? Did that bring any light or understanding into some of the questions and issues we had been talking about? Or anybody else want to share?
Yeah, I wanted to share, but it was about your first question, about how real this issue is for me. So my sister passed away in 2019 after 2 weeks after giving birth to my nephew. And it was from blood clots that traveled up and stopped her heart. And even before she was experiencing symptoms and she went to the doctor, but after you give birth, they always tell you, you just gave birth, just relax, take it easy. And so they sent her back home and did not address the issue, which could have been, with the proper testing, it could have been discovered, a week prior or 2 weeks prior, but it was never done. And even after she coded and the ambulance came, they just kept asking if she was on any drugs, and that was the main question. Instead of, and my mom, who was there at the time, is already aware of certain issues that can arise after a woman gives birth. So she was telling them that she thinks it's such and such, and they just kept saying no, and kept asking about drugs that my sister was taking. And even before my sister passed, my mother and I co-created a show which was called Mother Wit Echoes from the Womb, which was about a lot of the taboo topics that come up around pregnancy and childbirth. When we first created it, it was mainly about postpartum depression and psychosis, because that's what my mom experienced when she had all three of her children. With me, it was the worst. And it's a very taboo topic that people don't, at least at that time, didn't really talk about. Um, and yes, birth is a beautiful thing, but there are dark sides to birth. And I feel like the numbers are rising when it comes to women killing their children or killing themselves after giving birth. Um, and we felt like it was an important topic to talk about, instead of, pretending like it didn't exist or that it's not a problem until after it's too late and people have done the unthinkable to themselves and to their children. Um, so yeah, I'm complete.
Thank you for sharing, and I just want to say I'm sorry for your loss and trauma. There's just no words. It's unacceptable. It's completely unacceptable. And you know, there's just no understanding of it. It shouldn't be happening. Like I said in the beginning, these are things that could be prevented. And that's what hurts the most. That's what hurts the deepest. Um, it could simply be prevented, yet because of these evils, just the biases, the racism, um, which we just literally, my work um is to stand up against it, to stop it, to fight it, obstetric violence, obstetric racism. And I'll talk a little bit more about this movement I'm also a part of, called Birthing Cultural Rigor, that I'll share with you guys so you guys can all participate in that movement as well. Is there anybody else that wanted to share their experiences with the healthcare system as it relates to this topic?
I'll jump in. Maybe about 17, 18 years, 18, 19 years ago, when my wife was pregnant and we went to the hospital and we lost our first child, but it was just this very cold, disconnected, business-like manner in dealing with us. And, that prompted us, well, the rest of our children, to have home births with midwife. And that has been, one of the most powerful and greatest choice that we made. That level of attention, time, love, commitment, that level of practice and the integrity within it made all of the difference in terms of being able to launch the first passage in life, right? And so, it was very clear that after that first situation that happened, that we would choose a different route for ourselves, and it was very beneficial. And the level of commitment by midwives, doulas, and their mission, you know, is that they're angels, very supernatural. The preparation for it, as well as the experience itself and the aftercare, it was like, really someone who was in your family becomes part of you. I just wanted to share that.
Yeah, for sure. Absolutely. Totally agree. And, I'll, that's a perfect connection to, the other piece of information that I want to share, that contrary to medical doctors, who historically treated Black women inhumanely and only provided medical attention motivated by greed. Black midwives did it with from love. The domestic work of midwives to heal and tend to the needs of women, men, children was of maximum importance in the social life of the Black community at that time, of enslaved people, because it was actually the only meaningful labor in the slave community. Every other labor was forced. So for midwives to work and to practice and to deliver care for free to their community was something truly just genuinely based on the goodness of their heart. And given the egregious treatment of Black people by white physicians, enslaved people favored the care of midwives over doctors. The commitment to provide high quality care to the Black community in the face of violence and racism is a legacy that Black midwives cultivated from the beginning. And just as the gentleman just shared, clearly it's a legacy that is still carried through to this day. And it's proven time and time again. My research that I did comparing the experiences of Black women under the care of a traditional obstetrician, traditional medical model of care. You go to your appointments, you have your baby, you go home, versus the care from a race concordant midwife, for Black midwives, for Black mothers. The difference is astronomical. Women, just like the gentleman shared, reported their experience to be personalized, peaceful, caring, accessible, loving, supportive. They used all these wonderful attributes and themes came out of the interviews that I had with these women. It was normalized. It wasn't something like he was saying business like and cold and just foreign and just, this is not a business. This is so personal. This is like the most monumental life change. And so, women, the midwives really were able to deliver exceptional care. Was there someone else that wanted to share? I kind of got a notification. So basically,
I see Florence's hand. I'm sorry. Okay. I see Florence's hand up.
Oh, yes, I see that.
Yes. If I may, good morning, everyone. I am not so aware of the history. I mean, I'm really thankful for the history that you're providing and the context we're providing today. And I've gotten some other histories and context before. But one that I am particularly aware of is that there was an article published. I don't remember when the article was published, but it probably was published in the late 90s or so. And it did state that Black people were giving birth, were proliferating at a much higher rate than Caucasian people. And I think one of the things it was saying is that white people were saying, or white families decided that they only wanted 2 children or whatever, because maybe they couldn't afford to have more, or there was this thing about them having less children. But then I think this article was really alluding to the fact that maybe this is a bad thing for their race. And I really feel deep in my heart that since then, with all the added atrocities that were against us, that specific area became more of a focus. So at that now that then the it was the facilitation of birth, whether it was for financially, their families were given more resources and the whole conditions made better for them and so forth, at the expense but the opposite being done for Black women. I think that has a very, very huge implication. And so I did some research a few weeks ago, just looking at the rates of the white births and and the maternal health and everything. When it came to white people, and then the decreasing rates when it comes to Black people. So what it was like before that time is where Blacks were just proliferating and so forth, but then suddenly it started decreasing and the whites started increasing. So I have, at least that I am clear about, and I just wanted to put that out there.
Yes, Miss Florence, that same theme is, is a pattern that continues throughout history. The proliferation of great things in the Black community that have been stunted, eliminated, induced by racist tactics against us. And so I'll bridge into the next part of the history that I wanted to share, was that, I just want to highlight more of the phenomenal legacy that Black midwives had in this country. Even after the slavery period, midwives continue to be an integral part of life in the South for the Black community who did not have access to standardized healthcare. Midwives were the preferred caretakers. They were trusted. There was a high trust and reliance on midwives as leaders in healthcare in their communities. And that's all, is part of the continued legacy of midwives. And midwives were not only birth workers, which this part of the history kind of was enlightening to me. Because although I became a midwife 15 years ago, birth work wasn't the center of my practice. And I always doubted myself and questioned myself. And why did I become a midwife? Why did God allow me to become a midwife? If, birth work is not, I'm doing everything else. I'm doing community health. I'm doing public health. I'm teaching. I'm with children. I'm doing, healthcare in Haiti, all over the world. And, when I worked in mostly white practices, I always felt confused. And this is something that I personally shared with Shawnee the first time I met her. And it wasn't until I learned the history of Black midwives and learned about my own midwives in my own family who were delivering babies, but also curing infections and diseases and going to the community and helping out the community. Then I realized, just like the grand midwives from, history, that I'm just like them. We're here to be healthcare providers for the community. And I want to call out some names because it's important to learn these names and honor them, because they weren't honored. Their stories were omitted from the history books, from nursing school, midwifery school, which is why I didn't know and I was so confused for so long. I want to highlight, the name of Maud. Maud was a midwife who had a community health center. She was providing nutrition, clothing, vaccinations to children and everyone in the community. And so we had exceptional midwives, Black midwives, historically, being the medical provider, being the social workers, being the psychologists, being, playing the role of pediatricians, and sole medical providers for their entire community. And so, the history of midwifery is just so, Black midwifery is so grandiose, and it expands beyond birth work. But then, like Miss Florence was saying, we had competition. They had competition. They had the growing body of obstetricians, which were largely white male obstetricians. And they wanted to capitalize and govern and monopolize birth work completely. So what did they do to stunt that, to stop that, to stop Black midwives? They did everything they can. And they started by a smear campaign. They started smearing the names of Black midwives. It was so, I want to speak to how hostile, just like the trauma we've shared as Black and brown women during birth, very similar situation Black midwives had to experience and endure in their practice. So hostility from just a smear campaign. It was being said in campaigning that midwives were illiterate, that they were incompetent, that they were dirty, that they were, just any just vile name you could think of, they were saying it about midwives, about Black midwives. That they were unsafe, that they were unclean. And like I said before, there were no statistics proving that. As a matter of fact, there was research showing that a Black midwife in Virginia had way better outcomes, never caused any widespread infections like doctors did at that time, had excellent birth outcomes, but yet these unfounded statements, defamations were made against Black midwives. So not only smear campaigns, but then of course they also got involved with legalities and government. So slowly but surely they started to develop laws that revoked the privileges and the licensing and credentials of these midwives. It was illegal to give birth at home. It became illegal for these midwives to practice at all. Many midwives were incarcerated. Their licenses were revoked. And they were made to have to follow these impossible paths in order to become licensed. And of course, at that time, the schools weren't accepting them, weren't accepting Black women into their programs in order to get educated and licensed through the avenues that they were mandating. And so that's how, through many systemic ways, strategically, they slowly were able to eliminate Black midwives from practice, which is just so harmful and so sad, and it hurts my heart every time I'm reminded of that injustice, not only to Black midwives, but to the communities they serve. So when they eliminated Black midwives, who are they harming? The people who love them, the people who trust them, the people who go to them, use them. And so now you can have an idea and form some, conclusions as to now, why is the Black community now suffering disproportionately from poor maternal health outcomes. And, I think that one of the very important solutions is bringing back Black midwives. And so, like I said, if you remember some of the statistics I said earlier, in the beginning of, most midwives were Black. Black midwives were attending to their community in the South and the Northeast, were Black, indigenous, immigrant midwives. And guess what the statistic looks like now? Today, less than 5% of the midwifery workforce identifies as Black. And that's a direct result of this systemic racism that, eliminated Black midwives for no good reason at all. No valid reason, no valid justifications. I'll pause right there and
Yeah, so this is thank you so much, Dr. Kimberly. This is amazing context that you're establishing. It's making me think about just how do we continue to restore midwifery and within our community and create the pipeline that really helps and supports, and that will be able to counter what the devastating impacts that we're experiencing in the health profession, particularly as it relates to childbirthing. So family, we're at the 8 o'clock hour. Just wanted to recognize those who may have to leave at this time and transition. Please follow back with us and watch the replay if you have to leave. I'm putting Dr. Kimberly's information into the chat, so you'll be able to ensure that you're able to get in contact with her, as well as I'm going to post in the chat her offering, a special offering for today. All right. So at this time, Jasmine, if you would just read a lot of comments have been coming through. So please share some of those comments, and then we'll proceed.
Okay. I'll start from Sweetness. White men were in schools becoming doctors. For the most part, women were being housewives. He also says inhumane appears to be the norm for the oppressors. Florence says the disparities affect not only pregnancy and giving birth, but in overall health. The overall health of the woman affects the quality of the pregnancy and birth. Since we are not generally considered worthy of life, then healthcare is not a priority. The racism exists in every area. However, when it was published and acknowledged that I think this is a part of her share, that Black women were proliferating at a rate much higher than their white counterparts, I believe that the mortality rate absolutely increased. I feel that it is in direct proportion to the facilitation of the increase of Caucasian births. Sweetness says, the first passage, wow, a great view of birthing. Naja says, childbirth is so sacred and it should be treated as such. And I'm complete.
thank you. Thank you for those comments. And just along that same theme, I want to share this quote by Shafia Monroe, who's dubbed the Queen Mother of a midwifery movement. She said that the systemic eradication of African American midwives from Black communities was one of the darkest moments in the nation's history, which resulted in a legacy of birth injustices. The effects of the eradication of Black midwives produced disadvantages to the reproductive health of women, the well-being of their communities, and to the American midwifery profession as a whole. So Black midwives played a vital role in the growth of the profession, of the development of the profession, caring for their communities, contributing to the American midwifery tradition and skills. Not only were Black midwives essential to the livelihood of their communities, but they were integral to the foundation of the American midwifery birthing practice. And, you know, sadly, that legacy was omitted from most of the literature until recently, 2021. The American College of Midwifery finally started to acknowledge these transgressions against Black midwives, and starting to actually, honor Black midwives such as Oni Lee Logan, Mary Coley, Margaret Charles Smith, Biddy Mason, Gladys Nichols Milton, many who were, who also were unnamed, were heavily influential in the establishment and sustainability of the art and science of American midwifery. So I just wanted to honor that. And also want to say that Black midwives provided care services not only to the Black community, for many white families for many generations. And they were pivotal in their communities. They were transformative. They were transmitters of culture, folklore, health, spirituality. They were a source of empowerment and an unprecedented level of healthcare. So, like I said before, when I was sharing with Shawnee, I feel like, to me, when I learned this, it just enlightened me, because from there, I started to identify myself as a healer. You know, I'm not just doing birth work, I'm healing my community. And then that's when Shawnee said, she kind of agreed in her own story. She also calls herself a healer. So, we're multifaceted, multidimensional, at a core level, because of who we are. And I think that's brilliant. That's out of this world. And that's what I love about being a midwife. That's what I love about my history, as a Black, brown woman, and as a midwife. So the eradication of grand midwives had a profound impact on all women, not just Black women, but particularly more so Black women. And once midwives were eliminated, women had no other choice but to surrender to these, physician-led hospital births, and that just became the mainstream. And so this meant that one of the most racially charged eras in American history, the health of Black women was placed in the hands of negatively predisposed white male physicians. And as a result, many Black women in the Jim Crow era just avoided medical attention altogether. And so this also speaks to the woman who asked her first question, what about the valley? What about the care for our bodies? I think this is, it may stem from issues like this. We have no other choice. We have to, be under the hands of people who don't care about us, who don't believe us, who don't know us, who don't understand us, who really don't have our best intentions in mind and heart. Then why care? Why care about is our bodies even important? So the damaging discourse spread by the anti-midwifery campaign was not founded on factual data, statistic, or premised on quality of care measures. The anti-midwifery campaign was unfounded, racist, and sexist attack by white male professionals and their entire class of midwives of color. You know, an attack on the entire class of midwives of color. Just some feedback. Is this resonating with some of the questions you had in the beginning? I see some comments. Miss iPhone Sweetness, I see your hand up. You can share.
Yes, I'm thinking about how do we stand in our authority? How do we do that? So, as far as what you were sharing and what's been shared so far, and what we know thus far concerning going to the hospital, but then that means we are now willingly go to the hospital, knowing that we're going to a place where people do not have our good in mind, right? So how do we stand in our authority? How do we take it back? And I was just now also thinking about the school, right? We send the children to a school where they don't value who we are, and they're teaching us what they want us to know so that we don't know what we need to know. So how do we stand in our authority? That I I have to move to that. I mean, we've had we're having these conversations, and so to me, I'm just feeling the spirit of Malcolm X right now, as far as building our own, being standing in our authority. We cannot continue to go for help to the oppressor. And that's what I feel about this topic, this situation is like, yeah, the oppressor has made themselves very clear to us. So how do we stand in our authority? That's what I'm putting out there. And whenever I put a question out into the universe positively responds, because the answer is also inside of me. So maybe, yeah, that's what I'm putting out there. You know, I just want to have a conversation long enough to do something about it. I don't want to continue to have conversation. Yes?
Yes, totally
Okay.
100% agree with you. And I have a response to that as well, but I want to allow um, someone else to also share.
Peace and blessings, family. So I have okay, I respect the midwives, but in my case, having a high risk pregnancy, I had to go to the hospital. Um, and fortunately, I did, because my daughter was born prematurely. And so, you know, the midwives are great, but everyone can't use a midwife. So that's what I wanted to bring out. And then you brought something to mind that took me back, oh man, almost, well, 40 something years ago. And I had an experience, like I say, high risk, but having a miscarriage, went into premature labor, I would say, and having a miscarriage. Whereas years and years later, I went into labor prematurely, but they had medication to stop the labor and gave me some injections and stuff like that. So I'm just, bringing another side to it in terms of a person that's high risk can't depend on a midwife, or if, a home, and not a midwife, but at home birth. I'm just saying sometimes you have to be in a hospital setting if you're high risk. And I'm complete. I have a daughter, she's 45. She was 3 pounds, 3 ounces, born in 7 months, and she's here. So anyway, peace. I'm complete.
Yes, you're absolutely right. And I'm so glad you shared that because that is the truth. That is the truth. We need obstetricians and we need hospitals for reasons that you just mentioned, high risk. There are needs for them. The problem is when everybody is made to be, under those interventions and high risk situations when they're not. 90% of pregnancies are low risk and normal. 90%, the large majority. So don't you think it would make sense for the majority of people to be under the care of the professionals who have been shown to demonstrate better outcomes in low risk situations, which are the midwives? But contrary, the irony is that, everyone is streamlined to, is normalized to just go on to the hospital and go see an obstetrician when it's not needed. If you look at other developed countries, that's not the case. Most people deliver their babies with midwives. It's only in the United States where that happens. So I completely agree with you. I work with obstetricians. I love them. We need them for when we need them. And though that 10% of women who have high risk situations, for sure, we absolutely need to act on those conditions and give them the type of care that they deserve. 100% agree.
We have a question from Florence. Are there avenues for women to become midwives outside of having to go through becoming a nurse practitioner, etc.?
No, so there's different avenues to become midwives. There's various avenues. The avenue that I took, I became a registered nurse first. Then I got a master's degree to become a certified nurse midwife, and it was a dual master. So that's why I'm a midwife, certified nurse midwife, and women's health nurse practitioner. But that is not the case for all midwives. There's direct entry midwives. There's, professional midwives. There's different levels and different types of midwives. So yes, there's different avenues that one can take. And I wanted to respond to Sweetness, I believe the first question. She spoke about how do we regain that authority? And that is such an excellent question because that is exactly what, my research speaks about. It's something called authoritative knowledge. Back in the beginning of our country, midwives and women in the community held the authoritative knowledge. That means, what do most people, when you need to find answers to a healthcare question, who has the authoritative knowledge? We automatically think doctors, right? Well, back when midwives had the authoritative knowledge, anytime you had a question about anything related to pregnancy and birth, we automatically thought midwives. So how do we kind of shift? How do we shift? And that's what my aim is, to bring back authoritative knowledge to midwives and women in the community. And when you speak of authoritative knowledge, I also speak of cultural capital, right? Cultural, because right now, if you're pregnant, if you want to give birth, who has all the capital? They're the doctors and the hospital. So how do we shift that cultural, social capital back to midwives? And I think that it has to do a lot to do with research. We kind of have to play their game and prove on paper. We need, and that's why, again, we need to amplify our voices as researchers, as research participants. we need to make sure that our voices are heard, because we have the answers. The answer we've always known. We just now have to continuously demonstrate it, prove it, show it, put it out there, so that these, people in positions of power and authority will validate that. And we're talking insurance companies, because midwives need to be paid, for the work that they do. And currently that is a fight that's going on right now, with, midwives and how do we, do we pay them for their services? There's insurance companies that just refuse to and then that also kind of restricts the people who can use midwifery services. Excuse me a second. So Avi, I'm in a presentation right now. I'm sorry. That further kind of limits people who can access midwifery care, because people who don't have it to, pay out of pocket, which a lot of midwives, that's the only way they can practice. For people who can't afford that and only depend on, what their insurance covers, then they're limited. And they're limited. They can only use, obstetrician. So, it's a multi-dimensional, multifaceted fight here that we have to fight. And so, but the goal is, like she said, to regain that authority, regain that authoritative knowledge, that capital, that social cultural capital around childbirth and pregnancy, back to the Black midwives. And then lastly, I also want to say, remember that statistic, less than 5% of the midwifery workforce is Black. That's a problem. That's a huge problem. We need to also start from there. We need to promote more Black and brown women to go into the profession, to go into nursing, to go into midwifery. And there's further issues there because, there's hostility in the nursing schools and in the midwifery profession. And we need to end that at all levels, hostility, workplace violence, all that in our educational institutions, so that we can promote a healthy environment for Black and brown students, as in the system, in the educational system, and in the workforce.
Can I add something?
Yes.
I also wanted to acknowledge the fact that a lot of times when we do have our own things and ways to, ensure our survival, our care, a lot of things are done to destroy those things. And I don't know, I just feel like in a lot of ways we're blocked and stopped from really having those things that, when it comes to quality education, when it comes to healthcare and things like, and even, I've spoken to a lot of doulas and midwives, and even going into the hospitals, they have to basically come in there prepared to fight because, they're ignored, they're not listened to, there's fight back, like, doctors feeling like, oh, we know better than you do. And it's a lot that, it's important to have these, people in place, people of color in place, but at the same time, it's just like, I feel like a lot goes into it to block us from being able to really receive the services when, you have all of this pushback and red tape and things to keep you and prevent you from being able to practice freely. And someone mentioned before about the education system. I just saw a video the other day about all the things that they remove, all the mainly history of people of color have been erased completely from history books. And they were basically trying to say, you know, it's for the teacher to do research on their own and add this into the classroom, but we all know that's not happening. So it's hard to, not to say it's impossible, but it's hard because let's not pretend like, you know, when we have these things in place that, you know, things are not done to destroy them. And literally destroy them, like burning down places, hospitals, all types of things that cater to the Black community. So I just wanted to add that.
That's extremely valid point. I mean, everything you said was on point and truthful, and we could have a whole nother session just to talk about that. We could have a whole nother session just to talk about that, but I'll just, you know, share, you know, bring to the attention you know, what we just saw with the vice president of the HBCU who took her own life because of the hostility, the workplace violence, you know, that comes with being the only Black person or one of the few. The tokenism is not sustainable, is not safe. So yeah, that is something I'm also very deeply passionate about, because yes, we want to promote more Black and brown people in these spaces, but what are we doing to keep us safe? Nothing. They're not doing it. So yeah, those two things need to go hand in hand. Yeah, there's two more hands, so I want to allow an opportunity for other people who want to share. Miss Florence.
Well, I just wanted to add that to support the person who was saying that there is a need for the obstetrician because she had you know, births that were difficult and so forth. But as far as I wasn't born in this country. I was born in Guyana, and in Guyana, as far as I'm aware, the midwife did not try to exclude doctors or obstetricians from their, you know, the mother, they it's like they, as far as I understand, there were doctors on call just in case they were needed. It's like they did not just, you know, co-opt the entire process and decide that, you know, they were in total control and there was not, you know, there couldn't be a problem, because I heard about breech births and something they call breech births, and you know, there were difficulties. So sometimes a doctor or an obstetrician had to be on call and midwives would work with them. But it's when the racism, that is when they are given complete control and racism and cruelty is involved, that's where the real problem comes. So I just wanted to put that there.
Thank you, Florence. I like Sweetness has the question, and it'll be the last question of the session. We're at 8:30, so after Sweetness, then we can begin to wrap up.
Yeah, no, that's why I had taken my hand down, because I saw the time. So again, prayerfully, the facilitator, she already set it up so she could come back saying we need a part two. So we'll continue to do that. And so what I know for certain is that when I know something, I can either act or respond to it. However, if I don't know something, then that's the issue. And that's what I'm finding, because I have conversations with a lot of people, and I make it my business to have what I consider relevant conversations that impacts more than one person. Right. So I'm not talking about my issue, but when we're talking about issues that are presenting as far as schools, right? So that's the beginning. And then we got hospitals. So those are two major areas where we are not being treated fairly, and I even stutter to say that word fair, because that doesn't exist. However, humanely, I like that word, humane. So that's the thing here is let's have those conversations with people who may not know that this even exists. I would not have known to the degree that I know have I not been connected to Shawnee, to Wake Up Everybody, to Spirit of a Woman, and then what happened with Shamani. I would not know to this degree. I had some idea just because of certain circles I was in. However, let's start, and for those who started, continue to have the relevant and necessary conversations that will take us to where we can stand in our authority. And then you brought up something extremely, I think, important as far as insurance. You got to go. That's the arena you got to go so that they know that you for real. It's for real, and we not playing. And we have enough. Lord have mercy. Everybody want to be rich, but we have enough people who look like us with means to do what needs to be done. So that's where my prayers are gonna be directed toward, is being in those circles and creating those tables, where the funds are available. They ask us all the time, what would be your deepest, wildest dream if money wasn't an issue? And so I'm saying let our wildest dreams include us as a whole, as a people. And with that, I'm gonna pause. Thanks again for being here.
Thank you for sharing that. I would just like to leave this information with you. This is part of the Birthing Cultural Rigor Project. I'm an ambassador for them. It's led by Dr. Karen Scott. You see her picture down there. She's leading the largest kind of research of this kind in this country, and it's by a Black woman OBGYN, and she's basically trying to see how the experiences of Black women in the maternal health care system. So the cool thing about this as well, anyone who does this survey, completes the survey and the screening, will get a $50 gift certificate. So just share the link. I think we're going to share the link in the comment section. Just copy it, and anyone it's right now is only for women in Florida, Georgia, Michigan. You'll see the states right there: Mississippi, New Jersey. Unfortunately, New York is not there. But you can take a look at all the states included: Texas, Tennessee, South Carolina, Ohio. Yeah, so it's trying to analyze the mother's perspective of the quality of care they received in the hospital team for you, your baby, your support team. And it's important because like you said, how do we get the authority back? Through things like this. We need to show them, what's going on in their healthcare system, and so that we can, justify making these movements, these changes. So yeah, share it with whoever you can that's qualified, in the states that's listed there. There's a link, that you can share, and like I said, they'll get a $50 gift certificate.
Are you complete?
Yes, I am complete. I think the last slide is just, in my contact information, for those of you interested in just getting to know me a little bit better. I'm located in the state of Florida. I am a healthcare provider. I can do telehealth visits, but mostly, it would be for people here in the state of Florida. There's my number. There's my Instagram. I'm involved in a lot of things. I was actually just accepted to have a podium presentation for the National Black Midwifery Conference coming up in March in Virginia. So I'm really proud and excited about that. So yeah, I share those things on my Instagram, and my website, midwifenavarro.com, has a little more information about me. So again, this has been an honor, a blessing to be in this space with you all, to share with you all. I really enjoyed listening to all your valuable feedback. This was a blessing to me, and I hope it was to you as well. Thank you so much. Thank you.
Okay, so if you wish to give a love offering and donation for this wonderful session today, you can Zelle or Quick Pay at soulleadershipdevelopment@gmail.com or Cash App at #Spirit of a Woman. The code for today is #1026KN. If you want to set it up to do monthly automated love offerings, you can do $25, $50, $75, or $100 a month. You just go to bit.ly/woo love and the amount that you would like to give. Okay, up next we have on Monday, January 22nd, 2024, we have Sister Zariah. I hope I'm saying that right. Her session is Mama
Zariah.
used. Yes, okay, Zariah. Her session is Mama Used to Say. And then on Tuesday, we have Martine, who is doing the Plan from Ahead method. So tune into those sessions. I'm sure they're going to be wonderful. We invite your family and friends. The Woo Nation welcomes all new members. All right, so the Woo schedule, we have Zoom live workshops Sunday, Tuesday, and Thursday from 7 a.m. to 8:30 a.m. And on Mondays and Wednesdays, 7 a.m. to 7:30 a.m. We're streaming live on Facebook. And if you want alerts from Woo, just text Woo Nation at 74121. If you want some Woo swag, you can go to the swag store at bit.ly/Woo swag. You can get some cups, some shirts, beanies, leggings, whatever you want. We probably have it. And if we don't, let us know so we can get it. We thank you all and stay in touch. You can register at bit.ly/wake up movement. We're on Facebook at bit.ly/Woo community for the private page and bit.ly/Woo nation for the public page. We're on Instagram at Wake Up Everybody Virtual, YouTube at bit.ly/Woo on YouTube, and you can email us for any questions or information at info.wakeupseries@gmail.com. And we are complete. Can we please come off of mute and share with our wonderful facilitator, Dr. Kimberly? Just thank her for her time today and all the information she shared in the wonderful conversation.
Thank you, Dr.
You're
Thank
Kimberly.
you
welcome.
so
Thank you, Dr.
much.
Kimberly,
That
for
was
this
Thank you
wonderful
so much. I
great.
presentation.
I
appreciate you.
really
And that
enjoyed
That was
wonderful
speaking
beautiful.
with
As
it.
a
Too.
Lord,
grandchild
Celebrate
of a
you.
midwife,
Celebrate the
I
thank you for the
midwives
appreciate
great
you
group
support
this
that he had
time.
Conversation
sharing
that
for
was
When
and
you
the
come
so
back,
putting
rich
that out
of the
there.
Black
and you
woman
had
They
a wealth of
need
and the Black
midwives.
information, and we
Welcome
thank
her.
solutions.
you.
They
Eastern
save
Word.
lives. And
Up
thank
and
you
let's
for
move
what you
forward.
do.
Thank you for your heart.
Ashe.
Yeah, I appreciate your commitment.
Thank you. That was wonderful. That really warms my heart. I enjoyed it. I hope we can do it again. Peace and blessings to all of you. God bless.
We're all spiritual beings.
Peace and
Enjoy the rest of your Sunday. Amen.
Thank you, you too.